Welcome to Taking Up Space, the podcast with conversations exploring what it means to inhabit our bodies fully, without shame or apology, and reconnect with our innate wisdom to find healing and body liberation. I'm your host, Cassie Krajewski, a licensed clinical social worker and certified sex therapist. For over 10 years, I've worked with folks to reclaim their bodies, their inner knowing, and their lives in a world that often seeks to diminish their voices and experiences. Through personal stories, expert interviews, and candid discussions with guests, we'll unpack the societal norms and expectations that interrupt our embodiment, like trauma, oppression, illness and pain, and the social constructs of gender, race, sexuality, beauty, health, and weight. My hope is that through this podcast, we'll learn to drop into our bodies and occupy space, physically, emotionally, relationally, and intellectually, with confidence and authenticity. So join me as we challenge societal norms, explore what it means to find wholeness, and reclaim our right to take up space as an act of resistance and body liberation. While this podcast might feel therapeutic, it is not psychotherapy and doesn't constitute a therapist-client relationship. This is a good time to mention, too, that this podcast will at times use adult language, so listener discretion is advised. Hey there, welcome to Taking Up Space. I am here today with a really exciting conversation to share with you with Dr. Jennie Wang-Hall. So Dr. Jennie Wang-Hall is a licensed psychologist in California who has treated eating disorders at all levels of care since 2011. Jennie is passionate about community building and social justice education for mental health providers looking to learn about liberatory care. Working in various treatment centers and teams with various approaches, Dr. Wang-Hall has trained in many approaches, evidence-based approaches, and has witnessed the utility and futility of various modalities. These experiences have led Jennie to an eclectic and anti-carceral lens that facilitates empowerment and agency in eating disorder recovery. Core to Dr. Wang-Hall's approach is attunement to systems of oppression that manifest in both the development and the treatment of eating disorders. She integrates attention to ableism, white supremacy, misogyny, cis heterosexism, capitalism, and settler colonialism in her care of individuals from all backgrounds struggling with eating disorders. And personally, this conversation was so exciting for me because I have learned so much from Dr. Jennie after finding her on Instagram a few years ago. And her work and her thought leadership has really impacted how I've shown up in my own therapy practice as a therapist and has helped me shift some important aspects of my narrative in understanding the eating disorder treatment that I received as a client 15 years ago, and also as a mental health practitioner who worked at a higher level of care of eating disorder treatment. So Jennie voices so many principles and frameworks that I think are missing in traditional eating disorder treatment and mental health treatment overall. So whether you're a mental health professional or a client, I think you'll really benefit from listening to today's episode. So let's get into my conversation with Jennie. Hey there, Jennie. So glad to have you on the show. Thanks for being here.
Thank you. I'm so excited for our conversation. I love just getting to explore these topics with folks.
Yeah, well, let's just start with telling the listeners a little bit more about who you are and the work that you do.
Yeah, absolutely. So I'm a counseling psychologist. I've been working in the field of eating disorders for over a decade now. And yeah, really love doing this work. I've been in different levels of care. And, because I've been in so many different settings, I've been able to experiment with different modalities and approaches. And I feel really grounded in who I am as a therapist at this point and have, I think, a pretty unique perspective that merges social justice with, just sort of like person to person relational therapy. So yeah, I'm really excited to just keep doing this work. And I feel like a big part of my responsibility as a psychologist is the therapeutic healing, but also doing sort of broader systems level macro changes around food and body culture and the culture of mental health. And so I'm really excited to just talk about those things. So yeah, I love psychology. I love talking food and body. Social justice is a big part of the work that I do too. So yeah, that's kind of me in a nutshell.
Yeah, I mean, that is what has really drawn me to your work. I mean, I found you through Instagram. I mean, you have such great content that you put there,
Thank you.
but it's been so helpful for me professionally as a therapist, but also personally and understanding my
Hmm.
own recovery and the treatment that I received at that time. And you just offer such a refreshing voice and looking at the whole
Mm,
ecosystem of this. And so I'm
thank
excited to
you.
share that with the listeners here.
Thank
Um,
you. Yeah, I mean, social media is such a funny little bubble where,
mhm.
I've met amazing therapists and had such great conversations. And it's social media can be very toxic, but it also can be a place where real community building happens and people really are able to
Yes.
build connection around ideas that aren't always talked about in mainstream therapy, mental health, eating disorder spaces. So
Mhm.
I'm so excited that, we were able to connect and that my content has landed in a helpful way.
Yeah, absolutely. 100%. Well, how does your own body story impact the work that you do?
Yeah, absolutely. I'm excited to talk about this because I feel like everybody's story is so different and unique. And I think mine really informs kind of how I've gotten to this place. So, I had an eating disorder starting in adolescence, and my eating disorder was very much informed by kind of cultural standards around food and body, being biracial and having half of my family be API, lots of very rigid standards around what a body should be, what a person should be. So I had that on one side of my family. And then also, my mom was really immersed in diet culture, and there was a lot of dieting in my household. My mom is white. And so, kind of all around as I was growing up, there was a lot of messaging about food and body. And then going through some different kind of attachment challenges and difficulties in my family around adolescence, it was kind of the perfect breeding ground for an eating disorder. I already had this mindset around accomplishing certain I guess, like standards of being through food and body that had been taught to me. And then I was going through these things in my family that I didn't know how to make sense of. And so, eating disorder in adolescence, then, like, fortunately went into remission. Then I've had a couple of other periods of longer struggles, lapses. And basically, what has really helped me work towards recovery is social justice. It's really been social justice work and thinking about how my individual liberation from my eating disorder, from systemic racism, from ableism, from capitalism is tied up in everybody else's liberation. So
Yeah.
as long as I am stuck and sick and struggling, I am not of service to myself or to the other people that I so much want to see liberated. And so, while my perspective for my own lived experience is that I will always have living experience of an eating disorder, I always like kind of talk about providers who have lived or living experience because I
Mhm.
think there's a lot of pathologization around providers who continue to struggle in certain ways. And just because of what I've experienced with my eating disorder, I know that indefinitely I will have thoughts or feelings or perceptions, things that are different than maybe somebody who has never had an eating disorder. But that doesn't impair me from doing my work and the work that I love. And
Yeah.
so I think doing social justice work, really wanting to kind of dismantle systems of oppression that impact people in food, body, mental health more broadly, has been so motivating for me to make more loving choices, make more loving and intentional choices. And so I think that's a journey that I'm still on. I think it's a journey that I'll be on indefinitely. And it's one that I'm finding really rewarding because I'm not getting better because somebody has promised me this like perfect, super happy, rosy life in recovery. That's not at
Yes.
least what
Mhm.
I experience in recovery
Mhm.
necessarily, but what I
Mhm.
do experience in taking care of myself is so gratifying. So I think, yeah, that's kind of a little bit about how my food and body journey has really informed my work. And I think that will continue to transform. I think it will
Mhm.
continue to shift into the future. And I'm really interested in getting into some kind of birth trauma and postpartum work because
Oh,
that's been
yeah.
such a big part of my
Mm.
food and body journey over the last couple of years. So I think our lives have to inform our work. That's like how it's most meaningful.
Yeah. It's just so much spaciousness to hear you own lived and living experience because I
Hmm.
echo some of those sentiments of just the stigma that exists. I think
Yeah.
specifically in the eating disorder treatment field around like that was something I used to struggle with. I don't struggle anymore and now I'm
Hmm.
recovered. And that
Right.
can be a real setup for a sharp cliff when people struggle and because inevitably, right? Like you're saying, it's an ongoing process that will
Yeah.
be unique to you.
Yes, absolutely. And I think, I've really enjoyed just over the last couple of months running this provider solidarity group in my
Mhm.
practice. And it's, this group of therapists, we come together every week and the group is completely confidential. So, I mean, we're not talking about it except for me out in public, but like we all have eating disorders and we're all working through them and growing and healing and coming together to say we don't have anything to be ashamed of. Like, it's okay for us to support each other and feel love and compassion and kindness from each other and know that we're doing this challenging work, with our clients.
Mhm.
So I've really enjoyed getting to do that work. It's feeling really special. And I do want to just open up more spaces for providers who are
Yes.
struggling to say, this is what I'm going through. How is it
Mhm.
affecting my work? Can I get support around how it might be affecting my work or not? So I'm really enjoying that work right now.
And so important because I think it's hard to find safer spaces for
Hmm.
providers who have ongoing experience, living experience to really feel like they can show up and bringing all of those parts of themselves to it.
Yes, definitely.
Yeah. Well, one other aspect of your work is you are an advocate for abolitionist therapy as it relates to mental health and specifically eating disorders. Can you share
Mhm.
a bit more about what it means to practice from an abolitionist lens?
Yes, absolutely. I get really excited talking about this because I want providers to not be scared when they hear the word abolition, because it feels like a big word, a big statement, and it absolutely is. And it's not as scary as it seems. So, abolition is an inherently Black framework. And if we're going to talk about what abolition means in terms of helping people get freed and liberated, we would start looking at the abolition of practices of enslavement and Jim Crow, and now into prison abolition. So we see these, like decades and decades of rich work done by Black abolitionist leaders. And an extension of this framework is really around psychiatric abolition. And so, one of the things that I think a lot of mental health providers know but hesitate to talk about is how many people are involuntarily institutionalized. How
Mm,
many people are put on
yeah.
holds, how many people, we call 911 on because we don't know if they're safe. And then the police take them to the hospital against their will, or they have non-consensual police contact, because they weren't ready to engage with law enforcement in that state of crisis or whatever it might be.
Mhm.
So, thinking about basically the deep and rich principles of abolition in terms of community building, of working towards collective liberation, I think about abolitionist therapy as a way for providers and clients to create a culture of mental health wherein no one has to be institutionalized. And
Mm,
so I think this is really tricky because I think a lot of providers get very anxious about their licenses and
yes, the
ethics
liability
boards.
fear and
Yeah. Yes, the liability fear is so real, and I think that's something that, yeah, we can certainly chat about. I really love talking to providers about that, but I think that, ultimately, when we're talking about abolitionist therapy, we're talking about banding together with our clients to think about what a future without systems of oppression, at least active in the way they are now, looks
mm,
like. What does it look
mm,
like for us to actually intentionally and deeply care about each other? How does that shift the way we orient to our neighbors, to work, to our school systems, to politics, whatever it might be? So, thinking about abolitionist therapy as a way to intentionally weave together the personal and political. And when I'm sitting across from a client and I'm practicing therapy with them, I'm seeing them in the web of systems that they live in.
mhm,
And we're
mm,
integrating all of that into our conversations about, like, this week you really struggled with restricting breakfast every day. Like, you really had such a hard time. Let's unpack all the pieces there. Let's really talk about what was happening internally for you, in your immediate systems right around you, in your broader socio-political environment. How is all of this showing up in your body, in your nervous system? So I think abolitionist therapy takes the person in context. I also think that it conceptualizes change as multi-leveled. And so,
mhm,
I'm going to be out at a protest. I'm going to be, boycotting X, Y, or Z. I'm going to be making choices that inform the liberation of people, the liberation of all
mhm,
people. And I see that as a part of my responsibility as a therapist. My responsibility as a healer doesn't end when I log off or when I leave the room.
mhm,
It's really something that I think should be integrated into my life. Um,
Yeah.
and yeah, I mean, really, abolition, most importantly, is about imagination. Abolition is about
Mm.
getting excited about a future
Oh,
where people
yeah.
are free. People are free and have the opportunity to experience love and life in the way that we all should be able to, but we aren't all allowed under the systems that currently oppress us.
Yeah.
So that's really what abolitionist therapy is about. It's just about freedom and collectively pursuing that.
Oh, I love the frame of creativity and envisioning that just is so inviting versus what you
Yeah,
started with. Abolition can feel a little bit scary, that word to
yeah.
therapists, and
Hmm.
can be a lot more familiar and secure in a way to feel like I'm just in my professional role and this is I click into
Right,
this and then I click out of this. Um,
right.
but so true as we think about needs to happen for collective liberation. It's
Yeah.
all of us. Yeah.
Yeah. And I think, if we're not naming collective liberation, then we're leaving out a huge piece of what really contributes to eating disorders because we know that anti fatness is so much the root of at least the manifestation of many people's eating disorders, even if it's not the root cause necessarily. And I think if we're not naming anti fatness, if we're not naming size and weight discrimination, like all of this within the medical systems, all of these levels, if we're not identifying that clearly and saying, we need to make sure that all people in all bodies, fat, infinitive super fat, all across the fat
Mhm.
spectrum, are also getting free, then we're really not healing eating disorders. We're really not doing our
Yeah.
work. And
Yeah.
so I just feel like there's no way to, yeah, from my perspective, there's no way to sit across from somebody and do eating disorder healing without talking about
Mhm.
collective liberation.
Mm.
And like how uncomfortable that conversation is, like how
Yeah.
really uncomfortable it
Mhm.
is to say, yeah, I hold these perspectives, or these perspectives inform the decisions that I've made for the last 5 years, or whatever it might be.
Mhm.
But we can't dismantle it if we don't name it. That's
Mhm.
not an option. So I think
Mhm.
really having those conversations explicitly is what we owe our clients and what we all kind of owe our broader community.
Mhm. Yeah, could we talk even more specifically around how you have seen systems of oppression show up in eating disorder treatment specifically, like maybe at higher levels of care and
Yeah.
outpatient too, but maybe how mental health providers are trained or how that treatment is delivered within
Yeah.
that traditional eating disorder higher level of care.
Yeah. Absolutely. I mean, I think this is super important and something that makes a lot of eating disorder providers kind of squirm to think about the systems that we come from and that we're also continue to be embedded in. And I think is like also really refreshing for some folks to be like, okay, let's put it out there. Let's talk about it. So I think,
Mhm.
I'm seeing more conversation really come up around this, and I'm really glad about that. But I think basically, the majority of eating disorder providers, whether you're a dietitian or a therapist or a psychiatrist or whatever, we all are pretty deeply rooted in academia. Like most of us have advanced degrees, and academia is really rooted in capitalism, it's rooted in white supremacy, and it's rooted in ableism.
Mhm.
And when we're thinking about capitalism, these large institutions, they're very satisfied to take your money in exchange for what
Mhm.
is sometimes a very kind of like paltry offering of training. And that really varies from
Mhm.
program to program.
Yeah.
But it's interesting to see right now what's happening with universities and different educational institutions financially. But capitalism, there's the financial structure to it, but there's also the cultural structure of capitalism in academia,
Right.
wherein it is, rise and grind. Everybody is grind, grind, go, publish,
Mhm.
research, clinical, like
Yeah.
all of the things. And so providers are just deeply embedded from the beginning in this system of basically being kind of disciplined to be a productive citizen. And we carry that with us. We carry that with us into the field. And, white supremacy, I think we can look at some of the racial statistics around who gets into
Mhm.
master's programs, PhD programs, so on and so forth, who ends up in the field actually licensed if you look at statistics in terms of people of color versus white people. But then also thinking about white supremacy in a cultural way, in the ideology that is instilled into providers around, coercion and
Mhm.
hierarchical approaches to kind of leading people instead of co-leading or co-creating like a
Collaborating.
healing
Mhm.
process. Exactly. Collaborative work is not something that
Mhm.
we say the words, but we don't mean them
Uh-huh.
oftentimes in, training
Yeah.
institutions and things like that. And then ableism, I think ableism is really so deeply baked into our mental health field broadly. And it starts in these academic
Mhm.
training programs wherein we're told, you are going to heal that person. We are going to give you, you're
Mm,
going to pay us all this money and spend all these years getting this wealth of information, and you are going to be essentially that person's savior complex, all
mhm.
part of sort of ableism and white
Yeah.
supremacy.
Yeah.
And yeah, I think providers then feel this enormous amount of anxiety of, oh my gosh, I know all these things now. I'm supposed to be able to heal these people. And with eating disorders, that gets so complex. So that's kind of how I see some of it really showing up from the start in our training
Mhm.
programs.
Mhm.
And then I feel like what we see in the eating disorder treatment field is, kind of it's, I think it's really sad, honestly, because the way that we so often treat our clients is very similar to how we were treated in academic training programs. Like, we
Yeah.
really emphasize that our clients should be able to return to work, return to school, be productive citizens. Aren't you so sad that your eating disorder is preventing you from being able to go to school? Maybe that is what they're really sad about. Or maybe that's the top layer that we need to really peel underneath, because that's the layer of capitalism saying that, like, be a good
Yes.
person, you have to be a productive citizen. And yeah, I mean, I think there's like just blatant kind of anti-Blackness and various forms of racism within the eating disorder treatment field in terms of who gets diagnosed, who gets treatment coverage,
Mm.
what kind of treatment they get. So we see the extensions of white supremacy all the way into treatment in higher levels of care, who gets coverage and things like that. And then ableism, to me, ableism is the one that I think is really core for all providers to look at, because so many
Mm.
providers still feel like disability is like a dirty word. And,
Mm.
we can think through, do people identify as disabled or not if they have an eating disorder? I don't think there's a right or wrong way. But ableism is really this sort of ideology wherein providers feel like they know best. Providers feel like, let me write the
Mhm.
contract that
Mm.
you're going to sign and that you're going to agree to, and we can collaboratively create it. But not a ton of people love being on a contract. So, how collaborative is that
Yeah.
really? Or saying, if you don't do X, Y, or Z, I'm not going to be able to work with you, these
Mhm.
ultimatums. So all of that ableism just makes me feel like, even for the clients who it works for, like, they're so
Mhm.
unseen. They're so, yeah, just sort of invisibilized in their own healing process because they are not agentic. They are secondary to the
Mhm.
leadership of the clinician. And yeah, I think that it's really alarming how many providers view their clients as incompetent as a result of their eating disorder.
Mm.
And I'm not saying that people should agree with this or like it or whatever, but I got a PhD while I had an eating disorder. I
Yeah.
was very competent. I was able to do many important things while
Mhm.
having an eating disorder. And so the idea that I should sit down and tell somebody what they need to do with their life because I think so, that's just so deeply problematic to me. I think we really grossly underestimate and, yeah, invalidate what our clients with eating disorders are capable of doing.
Mhm. Yeah, totally. And it makes me connect to, again, how that's the breeding ground for the fear that I think
Hmm.
providers can feel with eating disorders. I mean, this is a primary area of practice for me, but I do a lot of consulting with other therapists in different areas. And so many of those therapists say, well, I don't work with eating disorders or I don't do that.
Hmm.
And I think there's just so much fear for people who don't specialize in eating disorders, but also those who are within the eating disorder treatment field that
Yeah.
drives a lot of this, right? And I mean, how are you noticing the connection there between how that fear manifests in mental health providers and how the treatment
Yeah.
that's delivered?
Yeah. I mean, I think that so much of the treatment that we do provide is really fear-based, because I will be the first to say that I am not a modality-oriented therapist. I would say if I am semi-adherent to anything, it's a more feminist or interpersonal kind of conceptualization of care. But I think that if we look at what happens in higher levels of care, so often we utilize very protocolized, very manualized treatment, ACT, all of these things
Yeah.
that you can give a worksheet or teach a module and check it off the list. And
Hmm.
I actually think that some of those modalities are really helpful for some people. I think
Hmm.
that they're not as helpful as we make them out to be, but they make clinicians feel better because you can say, well, we reviewed this.
Uh-huh. Mhm.
And insurance needs to see that too. Insurance is
Uh-huh.
going to be
Yep.
looking for, what treatments are you implementing that are evidence-based, blah, blah, blah. But I
Mhm.
think that so much of the treatment that we deliver is really around, yeah, just wanting to feel like we've given something meaningful, when
Mhm.
actually really what goes into meaningful eating disorder healing is way messier than any worksheet can ever capture.
Yeah, that's the truth.
And
Mhm.
yeah, it's so hard. It's so messy. And what I often tell my clients is some weeks it's going to feel like we did nothing. Some weeks it's going to feel like we went backwards. And other weeks it's going to feel like we're really moving fluidly, through something, because I can't give you a workbook. We can't sit down and do a workbook
Yes.
together and then you recover from your eating disorder. But I think a lot of clinicians, especially younger or greener
Mm.
clinicians, I should say, really want something
Mhm.
more structured because it appeases their anxiety, or it eases their anxiety, I should say.
Mhm.
And then
Mhm.
the liability piece, I think, is really important because clinicians work so hard for their degrees, they work so hard for their licenses.
Mhm.
And of course, you're going to want to protect that. That makes total sense. But I
Mhm.
think that clinicians also, because of some of the ways that we're taught, the savior complex, the hyper
Mhm.
responsibilization, are
Mhm.
really trigger happy with 911 and calling the police or going to the emergency room. And going to the emergency room or calling the police for somebody who is a 25-year-old, affluent, thin white woman is very different than telling your Black trans, you know, 45-year-old client to call 911 or go to the emergency room. Like, those
Yeah.
things are not the same. And I think our field does not look at that in the way that we need to.
Mm.
So, that doesn't mean that we don't respond to crisis. That doesn't mean that we don't take precaution and
Yeah.
and obviously are very responsive in the ways we need to be to crisis. But one of the things that I do, that I recommend all clinicians do, is a lot of pre-crisis support building, and that's more than a
Mhm.
safety plan. That's
Yes.
more
Yeah.
than,
Mhm.
yeah, it's more than just saying here are 3 skills you can use. It's like a
Mhm.
release of information circle. When you call me and you say you're suicidal, and then I call you back and you don't answer, I'm going to call your soccer coach because that's the person that,
Mhm.
signed a release of information for and you said you want in contact. That also protects me because like we were chatting about before, I have a small daughter. I can't
Mhm.
be chasing people down in crisis. I
Mhm.
need to have access to their support system to say, they're in crisis. They have a plan that we've created in terms of here are the anti-carceral hotlines, here are the skills, here are the tasks that the person needs assistance with during crisis. Um, yeah, I think that we can do a lot of preemptive work to
Mm.
take some of the panic out
Mhm.
of crisis,
Mhm.
which ultimately saves me a lot of stress, saves me a lot of anxiety, and yeah, lets the client kind of be in charge, have agency in terms of how they want
Mhm.
to be held and supported during that time. And unfortunately, for clinicians, the reality is that we need everything documented. We need to
Mhm.
document every step along the way that we were prepared, that we did all the right things. And if you are a clinician and you're young or you're green and you're anxious about your liability, do pre-crisis support building and document it all. Document
Mhm.
every single bit of it.
Mhm.
On my website, I also list anti-carceral like hotline and warm line and crisis
Amazing. I'll
resources
link that in the show
because
notes. Mhm.
yeah, absolutely. I want, like, when people call for my and get my voicemail, I don't say call 911. I don't say go to the nearest emergency room. I say, please consult my website for a list of anti-carceral crisis
Mm.
resources because I can't in good conscience
Yeah.
just do a blanket recommendation that somebody call 911.
Mhm.
And many providers, of course, feel like that's what they need to do. I
Mhm.
totally understand that. But
Mhm.
making other options, other resources like available, I think is a good
Mhm.
step.
Mhm.
So I totally get the liability fears. Like I might be singing a very different tune if I were 22 or 25 or something, but I,
Mhm.
have cultivated kind of this approach over the last decade plus. But it's hard and it's scary and this work
Mhm.
is so intense. So I do not fault any clinician ever for being anxious about their liability.
Yeah. Yeah. I love that you hold space for both the compassion of that, of just the difficulty in navigating these systems, and also like providing an avenue for an alternative way to think about how we can increase agency and resist these carceral interventions that I
Hmm.
think has just kind of been like the default for so many of us
Yeah.
in our training.
Yes, definitely. Definitely. I think we can get creative. We can get excited about doing things in different ways. And I
Mm.
love like this bizarre, small little Instagram community that I found where other providers like who
Yeah.
want to do this
Yeah.
work, who want to
Mhm.
like think about new ways of caring and new ways of creating relationships. So I think it's really exciting.
Yeah, it is. One thing I want to, thinking of social media, I think this is something you put on social media a while ago, but you said there is one good patient under capitalism, docile and agreeable, low relational needs, biometric progress, and an eager consumer. Can you share more about that?
Yeah, absolutely. Yeah, I think that capitalism really broadly in our culture defines who is a good citizen based on what they're contributing, to our financial capital as a culture, as well as what they're contributing to what their social capital is. So, how do they perform acceptability? What identities of domination
Mhm.
are they able to assume? Are they able to either minimize or hide any identities of marginalization that might make somebody in the dominant group uncomfortable? So, capitalism really tells us what kind of person we should be, and they're bright, shiny, productive, kind of go with the flow, fit into the traditional mold. And really, if we're taking it to a very fundamental level, that would be like a white cis male is pretty
Mhm.
much the ideal citizen under capitalism.
Yeah.
But if we're thinking about it like extensions of that, thinking about what an eating disorder patient might look like, you know, somebody who is an eating disorder patient that is going to be well liked, that is going to be palatable to a treatment system or even to an individual provider, is going to perform that eager consumption. What we want our clients to do is learn from us and be grateful and make us
Uh-huh.
feel as though we're like doing a good job.
Yeah.
And that's
Yeah.
not because we're just like jerks. That's because we do care and we want to feel like we're helping. But a good client under capitalism is going to perform that almost like apprenticeship. It's like an apprenticeship
Mm.
to
Mm.
the vehicle or sort of the
Mhm.
machine of like recovery. And yeah, just being very like low needs, because when you have big needs, when you have really intense emotions or complicated relational dynamics and they show up in therapy, that could be like exhausting for the therapist or that can be taxing for the therapist. And especially if the therapist is already burnt out, they're already working in some
Mhm.
sort of treatment institution where they're overly taxed,
Mhm.
they're going to resent that client potentially who has really big needs. So, yeah, I mean, I think the biometric progress is really how insurance companies, it's really just managed care is going
Mhm.
to define somebody's progress based on their weight, based on their vitals, their meal plan. Um, so basically, kind of, I think what capitalism does is it sketches out a version of recovery and a version of a healthy person it's one dimensional. It's not like a full
Mhm.
person with
Mhm.
thoughts, feelings, experiences, systems of oppression, like relational dynamics. It's these bizarre check boxes. And that isn't how real recovery happens. That isn't how people really invest in a relationship with themselves that sustains wellness. So, capitalism makes it really hard for systems and for us as individual providers to empower people to define their own recovery because it is this one kind of script for how it's supposed to
Mhm.
be done. So, really, we have to actively reject the ideology of capitalism in order to allow people to self define recovery
Mhm.
and actually achieve sustainable health.
Mhm. Mhm. Yeah. Thank you for that. I mean, it's,
Yeah.
thinking about the paternalism and eating disorder care too, and like how that
Mhm.
translates to people finding their own recovery. I think so many folks that I've worked with over the years have just felt like they figured out that system of like how to be a good client in this
Yep.
system. And that has had them go on a really roundabout journey to really find like what
Yep.
they really need or what's really important to them because it's still kind
Mhm.
of orienting to the same system, right? Of looking
Yeah.
outward to try and get the right answer or perform versus
Mhm.
like really being self-connected.
Yes, totally. I mean, I think there's almost nothing more exciting than helping somebody like I almost want to say like bearing witness to somebody defining their own
Mhm.
recovery because it's like I get to be this like partner in this very sacred process, but ultimately what I'm doing is like I'm like a vessel. I'm like a container and I'm here with this person helping them do their exploration. and watching them emerge with their definition of what recovery, health, like their journey to wellness, healing is going to look like. It's such
Mhm.
a privilege. I mean,
Mm.
I don't think I could go back to another version of
Yeah.
eating disorder healing after having done years of this work, seeing people I just liberate. That
Yeah.
really is what happens. And it's so beautiful.
Yeah. Yeah. And I know this is a piece that's really important to you too, around, we talk about all the fear, but also all of the benefits of
Yeah.
embracing and taking an anti-carceral and liberatory approach in mental health care and eating
Hmm.
disorders specifically. I mean, and I saw it just on your face. This is so sacred, this work that I get to
Hmm.
hold for folks. Can you share more about some of the benefits that you have seen there,
Yes. Yes,
personally or for others?
absolutely.
Mhm.
Yeah. I mean, so one of the things that I really enjoy kind of the most in my practice at this point is doing a lot of mentoring and supervision with younger clinicians.
Mm.
Um, Even like mid-career clinicians and stuff too, but younger
Mhm.
clinicians, especially who have a lot of like cognitive flexibility and a lot of like worries. So they're in a place of
Yeah.
oftentimes being very receptive to learning, and it's easier to undo some things that they may have learned in their training because
Mhm.
it's more recent.
Mm.
But I think what I really love about helping clinicians utilize anti-carceral care is that instead of being like solely responsible and carrying this enormous burden of somebody else's recovery around, they get to just be a part of this emergence of a
Mhm.
person. Like
Mhm.
I don't have to drag you into recovery. I don't have to like, teach you this Bible of skills
Mm.
because it's what, somebody told me that you need.
Uh-huh.
And if somebody needs skills, they need skills, and then we'll go
Mhm.
there. But I just feel like doing anti-carceral work and really centering the agency of your client allows you to be celebratory for the moments that are amazing instead of so anxious and overwhelmed and
Yeah.
tired that
Yeah.
you can't even see like the positive movement that's happening. I see so many clinicians sometimes who will come in and they'll be like, I've been working with this client for 2 years and nothing is moving and they're so stuck and we've done all this and this. And I'm like, they've actually made so much change. You're so burnt out that you're not seeing it, but here are all the things that I'm hearing from you. So I think, yeah, anti-carceral care really allows the clinician to be part of something so celebratory and beautiful. They can shed some of that hyper responsibilization. I also talk a lot about moral injury, and a
Yeah.
colleague and I, Stacy Godoy, who is a therapist, and I ran a group called the Provider Process and Support Group for providers who had worked at higher levels of care and basically had experienced moral injury,
Yeah.
had
Mm.
participated in practices, whether it was calling 911 or contracts or making somebody lick a condiment off their plate or whatever it might be,
Mhm.
that they felt so much shame and just grief around. And,
Mhm.
anti-carceral care really means being able to move away from that place of
Mm.
consistently being complicit in a system that doesn't feel good, that's not values aligned, and moving towards something that feels truer to who you are. And I think one thing that's helpful for clinicians to keep in mind is that my anti carceral care doesn't look the same as yours. Like we're different
Mm.
people.
Mhm.
Anti carceral care is not a modality. It is
Yeah.
not like a
Yeah.
skill that you can learn, it's an orientation to care work.
Mhm.
Um, so yeah, I just feel like there's so much freedom and so much joy in practicing
Yeah.
from a comrade partnership kind of standpoint
Mm.
instead of a like asymmetrical hierarchical
Mhm.
approach.
Mhm. Mm. And like liberation for therapists too, right?
Yeah.
That's,
Yeah.
yeah, that's huge.
Yeah.
So not
It
everyone
is
who
a game
listens,
changer.
yeah, not everyone who listens to this podcast is a provider. So I'm curious, for folks who have living experience or are working through their own process right now, and
Mhm.
this sounds really different to them, but also something they might want to pursue. How do you recommend folks to connect with folks that might embrace these principles or more liberatory
Mhm.
practices? Are there certain guidance that you can offer people in that work?
Yeah. I mean, what I will say is that I think it still remains challenging to find providers who are like actively anti-carceral and are really, I think many providers are radicalizing, which is awesome.
Mm-hmm.
And I think that a lot of people are still learning and growing, including myself. Of course, we're all learning and growing.
Mm-hmm.
But I really feel like interviewing your potential providers is a good place to start. And I know everybody offers discovery calls, but there are certain things that I think, people who are looking for a therapist or a dietitian might ask explicitly. Do you call 911? Do
Mhm.
you utilize contracts? Do you practice anti-racism actively in your practice?
Mhm.
How do you feel about client agency and autonomy? You know, whatever kind of key values you want to make sure your provider is
Yeah.
aligned with, I would just name explicitly. And the thing that's hard though is that you might get a lot of uncomfortable silences. You might get a lot of people with awkward answers. And
Mhm.
that might be your data. That might be what you need
Mhm.
to know about that person in terms of whether or not they're going to be a good fit. And I think not all providers like have the language or the
Mm.
jargon, whatever,
Yeah.
around some of this stuff. And so I think the other thing is just reading relational vibes around, does that
Mhm.
person really want to uplift what I want for myself? Because a
Mhm.
clinician who says, I want to meet you where you're at, okay, it's one thing to say that, but
Mhm.
what does that look like?
Yeah.
How are you meeting me where I'm at?
Mhm.
Because we can just give lip service to that all day, but that doesn't mean anything unless it's backed up by our
Mhm.
actions, our choices.
Mhm. Yeah. Yeah. And for therapists who also might want to explore this, I mean, how do you recommend that they get started? Are there books or podcasts or folks that you would recommend that they connect with or follow?
Yeah, yes. So, I mean, I started doing really my own ideology building around anti-carceral care maybe 3 years ago or so. A lot of it really around the advent of 2020 and George Floyd and Black Lives
Mm.
Matter,
Yeah.
as I was sort of more deeply embedding myself in like police and prison abolition, then starting to
Mhm.
do that extension, like I was talking before about psychiatric abolition and then the eating disorder treatment field. So I am still young in my learning. I don't think that there really are a lot of people in the eating
Yeah.
disorder field who have a lot more developed ideology.
Yeah.
But I will say that there are some really great books that I think are
Mhm.
helpful starting points, not for eating disorder providers and not
Mhm.
even necessarily for therapists, but for people who care about
Mhm.
anti-carceral care in general or abolition. There's a book called Decarcerating Disability. It's by Liat Ben Moshe, and it's a really deep dive into basically what care work is and the way that ableism has been baked in, the way that
Wow.
carceral
Mhm.
systems have gotten tied up in healthcare and mental health care. So, decarcerating disability is an important one. Care Work, which is by Leah Lakshmi Piepzna Samarasinha. And that book is an incredibly beautiful analysis of what it means to be a carer. It talks a lot about disability justice, which I think, you know, with our conversation around ableism, that feels really important for providers to
Yeah.
kind of get their footing around. What else do I love? I love We Do This Till We Free Us by Miriam Kaba.
Mhm.
That's a really powerful book on abolition that I think if you don't, I guess what I'll say is if you're not sure about prison abolition and you're not sure about police abolition, that's okay. You don't have to be. You know, do some reading, do some investigation, have some conversations. But regardless of where you land on the bigger sort of political systemic issues, immerse yourself in anybody who is imagining. Immerse yourself in
Mm.
anybody who is dreaming
Yeah.
new worlds, who is trying to
Beautiful.
envision something better for us. So
Mhm.
I like those three books for that a lot. My very good friend and colleague, Alison Inez Ford, has a podcast, the Body Justice podcast, which is outstanding. And she talks a lot about anti-carceral care as well. You can also totally link my resources page on my website because it has a lot
Okay, will
of
do.
books that I follow and other book recs and things like that. But also, I love providing supervision and consultation. So that's something that I offer for younger therapists who are wanting to, yeah, just like do this work and learn more. And I think it's important for therapists to know that in order for us to grow and become better for our clients, we have to be uncomfortable. We have to be willing to do the work and get really vulnerable and get really raw
Mhm.
about all the things we don't know, we don't understand.
Mhm.
I have asked so many questions to my friends or colleagues at different points where I'm like, I should know this. Like, I
Yeah.
should know what to say about this. I should have the right idea put together,
Mm.
but we just don't all the time.
Yeah.
There's so much to know, there's so much to get your head around. So if there's any providers listening to the podcast who want supervision or consultation, they're more than welcome to reach out to me. I'm trying to think if there are other resources that I really like. I think those are kind of the main ones, but anything that gets you imaginative, anything that gets you
Mhm.
curious is a good place to just open up that space inside of you that then you can build in anti-carceral care frameworks. But you don't have to dive straight into the deep end. You know, you don't have to like Yeah, you don't have to know everything right
There's
away.
lots of entry points, right? And
Yes.
I hear the common thread too is like community is probably so essential here when we're leaning into
Yeah.
this discomfort in these conversations of finding other
Yes.
comrades and co-conspirators to
Yes.
join with.
Absolutely. I feel like
Mhm.
that's so huge. I mean, I know that there are a million days where I just would not be able to do this work
Mhm.
without a comrade to text and be like, I need to decompress about this person who was in a really high risk situation and I didn't call 911. And now I'm really anxious that I didn't call 911 and I'm worried about them and I'm worried about my liability. And did I document this enough? Like all the things you need community absolutely to feel supported and yeah, like you can stand on your own 2 feet in doing this work.
Mhm. Mhm. Well, one last question for you, Jenny. What does it mean to you to take up space in your own life right now?
That is such a good question. And oh my goodness, I feel like I could answer this on so many levels.
Mhm.
What does it mean to take up space? I think, it's so goofy and I own such a teeny tiny little corner of Instagram, but like saying what I think out loud on Instagram to the eating disorder community feels like taking up space.
Yeah.
And to get messages where people are like, I don't agree with that. That seems really dangerous, or that's not whatever. I'm like,
Mhm.
okay, I don't respond to those because if somebody wants consultation to discuss it further, they can reach out to me for that. But,
Mhm.
like I appreciate getting messages of all kinds because it tells me that I am taking up space. I
Yeah.
am saying things that other people are hearing, whether they agree or not is not my responsibility. I mean, they can do their own work
Mhm.
around that. Everybody lands in different places. But yeah, I mean, I just think saying what I feel is right about eating disorder care and care work in general feels big. And it's small. My Instagram presence is very small, which I'm actually really grateful for, but it's big enough that I know that my ideas are landing somewhere.
Yeah.
So I think doing that work of just using my voice and saying what's uncomfortable and unpopular sometimes.
Mhm.
I also think that speaking more about having living experience of an eating disorder is taking up space.
Yeah.
And it's taking up space that like I think makes a lot of people uncomfortable. What does it mean for me to say, yeah, I'm actually not doing great over the last week.
Mm.
I'm feeling really stressed, or I'm having these urges, or my body image, or whatever, or I'm having these rigidities. What does it mean for me to say that, not in a session, but to a colleague, and for that colleague to hold and respect that's my lived
Mhm.
experience, and that I'm a competent, wonderful
Mhm.
clinician.
Mhm.
So I feel like I'm just like occupying space in a really new way around that identity. And then the last thing I'll say is that I'm a new mom. I'm a new mom. I have a young daughter, and I think I am learning how to, when you first have a child, you become so immersed in your child's space, everything centers around them. And
Yeah.
I'm finally getting to a place where I have just the tiniest bit of autonomy back, and I can walk away when she takes a nap. And,
Yeah.
I feel like I'm occupying a little bit more of myself
Mhm.
again than I've been able
Mhm.
to for quite a while postpartum.
Yeah.
So just on all of these like professional and personal levels, I'm really stretching. I'm stretching out
Mhm.
and yeah, I feel really good about where it's going. And also like I'm totally okay with not knowing how or where I'll take up space next. Like I think so much of this liberatory work is about following like the moment while also having
Mhm.
your values in mind. So, you know, I
Yeah.
don't know, but I'm happy with where I'm taking up space now.
Yeah. Me too. I mean, I feel like I'm really benefiting, and I know so many others are benefiting as well.
Thank
Jenny,
you.
thank you so much for this conversation. It's just been
Yeah.
so, so lovely to hear more about your ideas and hear you speak them and voice them. And
Thank you.
just such an important, empowering force in the
Thank you.
world.
I mean, so lovely to have this conversation because I just feel like I want to share these ideas with anybody who wants to listen and
Mhm.
chat about them. So thank you so much for the opportunity.
Yeah. Jenny, if folks want to find you and learn more about your work, how can they do that?
Yes, absolutely. So I'm on Instagram at Dr. Jenny WH, dr.jniewh. And my website is jwhrevolution.com. And there's a lot of information about me and my team. I have two other wonderful clinicians in my practice. So you can go to our website to read about me, the team. If you want to check out any of those anti carceral resources, there's a whole list of them on my website. Um, And yeah, I mean, I love communicating with folks. You can reach out to me. All my contact info is on the website. And if you're a clinician who wants to chat about these ideas more, please don't hesitate to reach out and we can connect. If you are, a client, a person with lived and living experience who's looking for more support, please know that we're here for that too. So yeah, I just love to connect with folks. I'm eager to see what conversations spur from this.
Amazing. Thanks again, Jenny, and to everyone listening. Thanks for being here, and I hope you all take up a little bit more space this week. Thank you for listening to Taking Up Space. I hope you enjoyed today's episode and found it to be a resource for you in your own embodiment, healing, and body liberation journey. I hope you can continue the conversation with me over on social media by sharing your thoughts, offering your ideas and suggestions for future episodes, or just connecting. You can find me on Instagram at Inner Atlas Therapy. If you liked this episode and want to support the show, please subscribe, rate, and review the show in your preferred podcast platform. And share this episode with a friend. This ensures that more people can find the pod and will amplify our message of body liberation for all. If you haven't checked it out yet, I have a free Taking Up Space workbook available. This workbook will have you engage in self-reflection and embodied practices as you navigate your own journey of taking up space. You can find this free resource on my website, inneratlastherapy.com. I'll also link in the show notes some additional resources I've developed in my online shop to help you deepen into your own embodiment, healing, and body liberation work. Thanks again for being here, and until next time, I hope you join me in the resistance and find some ways to take up space this week. I'll see you next time.